Good morning, respected members, seniors, and my friends. As most of you already know, my name. My name is Dr. Prashant Deshmukh, and my friend name Yash Chavhan would like to give a presentations on NGO AROGYA RAKSHAK Sanstha Sanstha Nanded on the behalf of Symbiosis Institute of Health Sciences, Pune. The purpose of the today presentation is to help you to all understand the expectations of AROGYA RAKSHAK Sanstha, and I plan to go over in detail about how these organizations run, what are the aim and objective of this NGO, as well as what is the philosophy behind these organizations, and what are the funding structures and volunteer networks of these organizations of AROGYA RAKSHAK Charitable Trust. This meeting is going to be take around 50 to 20 minutes, so not much waste our time. Let's start to understand the AROGYA RAKSHAK Bahudeshya Sevabhavi Sanstha Nanded. Next slide. So talking about the aim of this NGO, so the primary aim of this NGO is to ensure adequate, qualitative, preventive, and curative healthcare to people of the community, and to create health awareness of the urban and rural community. The public organizations, various health-related camp implement the project related to the health issue and run the organizations of AROGYA RAKSHAK Charitable Clinic in Somesh Colony, Nanded. And the secondary aim of this NGO is to run a homeopathy treatment camp and promote and propagate the science of homeopathy to people. Next slide. Now moving further, let's talk about some essential objectives of NGO. The first objective is to make whole India is healthy. The second objective is to create health awareness among the people in society. Then third objective is to create convenience, importance of the health to society. Then next is to create health and environmental conversations awareness. Next is to create awareness about the infant and woman health. Next is to create awareness about the health and hygiene. And last but not least, the cultivate mental, social, and physical health of the community. Next slide. Now, in this slide, we talk about the progress and contributions of the NGO to society. As we know, since 2016, AROGYA RAKSHAK has reached out of 150 villages across the Nanded district in Maharashtra. AROGYA RAKSHAK Sevabhavi Sanstha holistic development model covers all aspects of individual and community development through a unique 4 key. First is engaging, second is empowerment, third is execute, and fourth is exist. Engaging means the NGO engage a variety of activity related to the health like homeopathic camp, blood test camp, awareness camp, and blood donation camp, etc. The second is empower. AROGYA RAKSHAK NGO member train the resident of poor community to organize themselves and learn to get things from power structure. Then third E is execute. AROGYA RAKSHAK NGO execute a various camp, and last E is exist. As well as AROGYA RAKSHAK work is benefiting over 5 lakh people towards with the ultimate objective of making whole India health and creating the health awareness towards the society. Now, AROGYA RAKSHAK Charitable Trust has a strong team of 150 members with doctors plus student volunteers, 10,000 community volunteers, plus 25 plus full-time staff workers for the betterment of NGO with the objective to make India healthy. Next slide. Now moving further, let's talk about what is the philosophy behind these organizations. In challenging environment of the healthcare industry, every NGO has a work to for the betterment of health towards the society. But AROGYA RAKSHAK believe that the India will never achieve its true growth story until the rural sector of the country is employed to make choice and transform its own lives. With this thought, AROGYA RAKSHAK Charitable Trust was established in 2060, and in 2060 share a metamorphosizing into the AROGYA RAKSHAK Charitable Homeopathy Clinic with a mission of the whole India healthy and to create a health awareness through a unique 360-degree development model which covers 5 key therapeutic area, namely health services, nutrition, education, water and sanitizations, and economical development. And AROGYA RAKSHAK Charitable Trust aim is to run a homeopathic guidance camp and promoting and propagating the science of homeopathy. Next slide. Yes. Now moving further, let's see a glimpse of NGO. That means this NGO runs from last 6 years. The first program run by NGO is free homeopathy consultations camp. Also, we can see in this picture how Arogya Rakshak has done their work for community, and every Monday morning 8 to morning 10 a.m. free checkup and free homeopathic treatment at Arogya Rakshak Charitable Homeopathic Clinic, Sidco, Nanded. Next is fitness camp. Arogya Rakshak has done so many fitness camp, but this is one of them. On 27 January 2019, an Arogya Rakshak cycling member participate in cycle ride towards the fitness with Nanded cyclist Dr. Devendra Palewar sir, as well as we all know the regular cycling maintain our health and reduce the cardiac risk. The next is blood test camp. On 12 January 2019, Arogya Rakshak Bahudeshiya Sevabhavi Sanstha Nanded arranged a complete blood test camp at Big Bazaar, Kautha, Nanded. In this camp, every member check their blood, in which lipid profile, kidney profile, then thyroid profile, iron deficiency profile, then diabetic screening profile, CBC, etc., and so on. Next slide. Then next is homeopathic camp. On 13 July 2017, arranged a free homeopathic camp by organized Arogya Rakshak Sanstha and Dr. Samuel Hahnemann Homeopathy Clinic in Bachoti, Taluka Kandhar, District Nanded. This is an extraordinary experience in Bachoti rural people approach towards the homeopathy system, and Arogya Rakshak team examined 230 patients in Bachoti. Bachoti is a very rural area in Kandhar Taluka District, Nanded, and there is no specific medical system in that area. And the primary aim of the Arogya Rakshak is to provide healthy health to every people. Then next is a picture you can see in the Arogya Rakshak Bahudeshiya Sevabhavi Sanstha arranged a tobacco awareness camp on 31st May 2016, World No Tobacco Day, by holding a symbolic Holi of tobacco was celebrated with an oath that I will not take tobacco and not allowed to take others. That means this is one of the most important awareness camp organized by Arogya Rakshak. Then a free health checkup camp. On the occasion of 25th birthday anniversary of Dr. Babasaheb Ambedkar Youth Bhim Nagar under the Samuel Hahnemann Homeopathy Clinic, Vasarni and Nanded, and Arogya Rakshak Bahudeshiya Sevabhavi Sanstha Nanded, the camp provide free checkup and homeopathic medicines to 150 patients. That's all from my side. My friend Yash Chavhan take further presentations. Over to you, Yash.
Thank you, Prashant. This is a wonderful presentation, and you give a good introduction about this NGO, that is Arogya Rakshak Bahudeshiya Sanstha. Now moving further, now I'll explain about the funding mechanism of the NGO. So how the funding is to be created by the providing the services to the people or the community. So the first is all medical department of the Arogya Rakshak Charitable Trust take the initiative and arranging the camps for the patient. And when the expert consultation is available, so they give the free of cost and the diagnostic camp services and provided to the conventional rate to the patient and to the people. So with that, they generate the fund to for this NGO, and it also simultaneously it helped the people among the rural villages and the community. So the second is the various camps they were organized in year 2016 and to 2022. So including they are creating a multiple camps. So the first is the free medical checkup camp at Sidco. They diagnosed with 250 patients. In that they including like a free homeopathic treatment or the free consultation treatment about the giving the nutritions or the simultaneously they give the health advantage on how to build their health to the society and avoid the unconscious or the uncertainty of this health toward the people or towards this community. The next is the fitness camp. In that, people they keep motivating themselves for the keep their healthy diet and toward the fit for this health. The next is the blood test camp. Then another is a free medical checkup at Basuti district Nanded, and the last is free checkup camp at the Khobragad Nagar Nanded. So the next is detail about the charity funding and the mechanism. So the Arogya Rakshak Charitable Trust has allocated the outdoor consultation OPD at a Somesh Colony Nanded as a free consultation to encourage the free consultation for the poor patient. The next is with that, the poor and the non-affording patients are provided either on the concessional or the free treatment as recommended by the medical social worker or the some specific consultant of the particular department. Like the dentist, they are providing the dental consultation to the patient for the treatment of those people who are suffering from the dental diseases. So they give the free consultation about the on the given of the dental treatment. The next is the partial conscious or the diagnosis stage. So in that, the senior citizen or the patient coming from the villages or the old age home are given a generous conscious, and also from the walking the patient from the different location are considered for a concession based on the recommendation of the social worker, and it helps the rising fund for this NGO as well. The last is Arogya Rakshak Charitable Homeopathic Clinic. It helps to provide gift and essential services to enhance the health services and to educate the patient and their families. So with that, so the people or some of the patient and also the community of the people, so they encourage toward the health and promoting the health awareness among the people. So this is the main aim and objectives of this Arogya Bahudeshiya Sevabhavi Sanstha, which promoting the health awareness among the people. So with that, this is all the aspect they will follow to generate a fund. So now talking about the monitoring and the evaluation. So in that, so Bahudeshiya Sanstha have three places or the three branches. They are located in Nanded. So the first is Dr. Samuel Hahnemann Homeopathic Clinic was started in Vasarni, Nanded. So the main objective of this clinic is to create the health awareness among the people. And the second is the convincing the importance of the health to the society. The next is the Arogya Rakshak Charitable Homeopathic Clinic was starting on 13 June 2021 at Somesh Colony, Nanded. So that their major objective is to create the awareness about the health and the hygiene. And the next is to cultivate the mental, social, and the physical health to the people. The third is Arogya Rakshak Charitable Homeopathic Clinic was starting on 18th August 2021 at Somesh Colony, Shidko, Nanded. So their main objective is to create health and the environment conservation awareness among the people. And the second is to create awareness about the infant and the woman health consciousness or toward the society or the people. So here in this slide, now we'll discuss about the volunteer network, those who are working in this NGO. So the main volunteer are the first is the Dr. Sunil Deshmukh, Dr. Akash Khare, Dr. Amol Narvade sir, Dr. Ram Paude, Dr. Yuvraj Jadhav, Dr. Turnar, Dr. Ingle, Dr. Limbole, Dr. Niranjan Kasole, Dr. Datta More, Dr. Kasal Keshwa, Dr. Sopan Jadhav, Dr. Rupesh Bhosle, and Dr. Bhagwat Dure. So, and the basic of the talking about the general body or the member of the Arogya Bahudeshiya Sevabhavi Sanstha is, so the first and foremost is the Samir Jatale, who work in advertisement and the related to the work they are handling. The second is the Manoj Patange, who give the yoga consultant or as a working in a yoga consultant and giving the consultation to the people about the advantage or the yoga. So with that, how to enhance their positivity mindset and to make the healthy. The third is Anil Patange, who work as a public relation member. The next is the Ganesh Kangole, who work as a public relations member. The next is Adil Pathan, who as a working in this NGO as a worker. And the last is Yash Pathan, who working as a worker. So also this NGO is segregated on the basis of the department. So the first is homeopathic. So in that, the number of volunteers are working. So that is a 150 member of the doctor and plus volunteer are working in the homeopathic department. The second is Ayurvedic. So in that, the 10 member are doing participated in this NGO from this Ayurvedic background. The third is dental, in that the 10 member or the volunteer been participated for the promoting this NGO. The second is obstetric or the gynecologist, in that the 5 member. The second is ophthalmologist, in that the 3 member. The next is chest physician, in that the 1 doctor. They are generously doing the or promoting the health NGO. The second is orthopedic, in that the 2 doctors are being working or to giving the guidance of the to the people or the services give the society about their the orthologist. The second is the general surgeon, in that the 1 doctor has been working for the promoting this NGO. The last is the pediatrician, in that the 2 doctor has been working. So in this pie chart, so on the basis of this number of the doctor and department will be segregated on the basis of this pie chart diagram. So in that the majority of the people are from the homeopathic background. So thank you all the department or all the member of the group to promoting this health NGO or to the people or toward the society with aim is to make the India healthy. So these are the some visiting picture which I would like to show to you. The first picture in that the Sunil Deshmukh sir, me and my friend Prashant. So this is a main branch which is located at the Somesh Colony, Nanded. So as we everyone know, in the second picture, the none other than our friend, they are helping to the people or giving the medicines or the people. Also, they are the working as a Sarpa Mitra. So this is a great job. They are doing well. In this picture, our none other than the Dr. Satish Jatare sir. And sir, thank you so much for giving this opportunity to me and my friend to be working with this your organization. And we learn a lot of things from how the NGO is to be work and how the multiple factors like funding or the volunteer network or how to work with the people and promoting the health awareness among this society. And this is a photo, the outside of this clinic from the Dr. Samuel Hahnemann Homeopathic Clinic, which located at Basarni, Nanded. And finally, thank you, sir, for giving this certificate as well. So which really help us to doing a great job in future as well. And we would like to give give the thank you for all the from family of the Symbiosis Institute of the Health Science as well. And thank you so much for this giving the opportunity for creating or to make a knowledge to build up the how the NGO is to be work for this health consultation. Thank you so much.
Thank you so much, sir. And